Okay, thank you very much for joining us today, Professor Baru. It is an honor and a privilege to host you on our podcast. It is October 7th, 2024, here in BC. And we're very, very happy to have received your consent form signed and you being aware of the project. And we are glad to learn from you today. Before we go into the specifics of the question, I want to ask if you have any questions in regards to the project.
I think your email was self-explanatory, and as we go along, if I have any questions, I'll ask you.
Okay, wonderful. Thank you once again. Okay, so another question we would just like to pose before we get into the 6 questions that were shared with you is just so that our listeners have a better understanding who they are listening to, we would like a little bit about your positionality. So please feel free to share as much or as little as you would like to about yourself professionally and personally. Thank you.
Yeah. Well, I was born in Chennai, but grew up for a large part of my life in Delhi. But I also lived in Rome as a child for 2 years, and then lived in the US where I finished my schooling, but decided to come back to India, not do my undergrad in the US. I trained as a medical and psychiatric social worker with a basic science training in my undergraduate, and this was in Kerala. And then I proceeded to work for about 4 5 years in community based projects for rehabilitation of disabled children, and then proceeded to um, work with the Handicap Corporation in Andhra Pradesh, where we did some fairly innovative approaches. So my pre uh, MPhil, and I got back to academics after that and decided to move out of what I saw as theoretically confining framing of medical and psychiatric social worker. I mean social work to going into the field of public health because I felt it offered interdisciplinary opportunities. It also raised questions around political economy. And one of the themes which I've pursued over the years is the question of inequalities and trying to understand both the social inequalities but also how they get reflected in institutional inequalities. So, the focus of my work has been much around that. Um, taught in, well, anyway, then I worked with Voluntary Health Association of India, um, and did considerable amount of work in very diverse areas like the ethics of organ transplants, transplantation, um, the questions around inequality and health, women and health, commercialization of medical care, which was my PhD work. And then I had a position that was offered to me at the Jawaharlal Nehru University, with a lot of conflicts in my mind whether I should be with civil society or in a teaching institution. I think the idea of being with young people kind of moved me to the uh, JNU, where I spent last 30 years of my life, professional life, um, because JNU represented some of the important values that were very close to me. The idea of social justice through affirmative action, but more importantly, that as a public university, uh, I had the freedom not to be driven by funding. So we were allowed to craft courses. We were allowed to build ideas around public health, which went beyond medicine. So I think we were unique in that we were located in the School of Social Sciences, but more importantly, that we were an interdisciplinary mix of faculty where we had both doctors and social scientists. I'm a social scientist by training, as you know. So there was, and it was also the ethos of JNU where you could have these conversations. You weren't siloed by disciplinary boundaries, so you could explore both in terms of conversations, but also very importantly in the way we developed our curriculum. We had a lot of freedom to use various pedagogical techniques. We were dealing with classes where we had students from very diverse backgrounds, socially, but more importantly, even in terms of um, intergenerational kind of issues, where we had a lot of first generation learners who did not either have the cultural or the social capital to negotiate elite institutions like JNU. So it was a very humbling process for someone like me who clearly was, a woman, but belonging to an upper caste, upper class kind of a social background. But having said that, was not religious, was very involved with the communist student movement when I was a student, and later even as a teacher. But I had, and also with some feminist movements. But I never got straight jacketed into them because I contested, I quit the Communist Party for various reasons which I felt were to do with control and power, especially patriarchy operating in these institutions. So, I mean, after that, I kind of held my own as engaging with issues with the various progressive movements, but not getting caught up in that bureaucracy in a sense. Um, so, if you want to ask anything else, I'm happy to answer.
Okay. Thank you very much for sharing your professional background and a little bit about your personal background. I think our viewers have a good understanding of your positionality. You've done lots of great work. You've contributed in many kind of ways, and it seems like you've come in with multiple perspectives along the way in the different work experiences you've accumulated. So that's wonderful that we have somebody like you with that wisdom with us. So with that in mind, let's go into the questions. The first question is, how do you understand social justice in your discipline as a senior faculty member?
I think I really want to go back to public health as a discipline as it has evolved historically, because the public health we know today is extremely has been driven by and influenced by, and I'd say really with the rise of neoliberalism, with the discipline of economics. So I want to just step back a bit and look at the history of public health and its rootedness in the idea of social justice. So, I mean, I keep telling even my students that ultimately public health as a discipline is about values. It embodies certain core values of equity, issues around fairness. It also talks about universality, which is very much embedded in the idea of rights and citizenship, and also the very important aspect of social justice. So, which means you do come into the relationship between politics, policy, and health, which public health talks about. I mean, it is a core value, and historically has been so. It is also the case that it is talking about redistributive justice. So I think, as a discipline, historically and in its broadest sense, is not just about how can you do good programs, how do you change behaviors of people, but you're asking fundamental questions on how is society structured, how do these structures influence um, the various institutional forms that are required to reduce suffering of people. But at the same time, the history of public health, which has its roots in Europe in social medicine, um, talked a great deal about values. And I think the values being that how much inequality will you accept? Is it fair? Is it just? And I think those debates actually came from the discipline of medicine itself, because uh, at least in the 20s and 30s, when allopathy wasn't did not have all its armaments in place, I think there was this sense that we need to go beyond just disease, but we need to understand what causes disease beyond the germ. So I think that it's a very interesting period in history where you are looking beyond medicine and health, but you're also looking at other determinants of health, which we today talk about as social determinants, but devoid of all its politics and other things. But essentially, to say that that stream, I think, remained fairly alive, and it was kept alive by clinicians in public health. So, which is why you see a kind of a it kind of receded to the margins, but it did not go away. And I think a lot of people working with patients in institutions, in grassroots programs, and I think the influence of the Chinese Revolution and the barefoot doctors had a very significant influence on certain sections of the Indian medical fraternity, I would say, as well as those outside, I mean, from other disciplines like mine. Um, and it was also a period of great ferment in 60s and 70s when post-colonial societies decided to rebuild their nations. And I think there was a great deal of debate and contribution of economists on the unequal world that we live in, the world economic order, and more importantly, questions around justice. And I think it wasn't as strong in the Indian context, let's say it was in Latin America, where you really had a lot of progressive movements that, in a sense, influenced even the medical profession. So, so you had the Catholic Church, you had the schools of medicine, especially in Brazil, Chile, etc., that you know, came up with new forms of Venezuela. In fact, I was quite surprised. Newer forms of pedagogy, of, in a sense, socializing medicine, bringing in what we think are very important social and political determinants of health, um, and this idea that you have a focus on the needs of the poor and the marginalized. So, in that sense, the center I was in for 30 years was called the Center of Social Medicine and Community Health, and not the Center for Public Health, because I think ideologically there was a great deal of influence on bringing back social medicine to the table and looking at the questions of inequalities and looking at political determinants of health. Um, so, as you can see, the canvas was widened to understand these questions from the point of causality. And social justice then becomes the primary focus for a lot of these questions. But schools of public health subsequently, under the American influence, moved further and further away from this kind of a paradigm. So even today, you can say we are the only one that has a pedagogy that, or a curriculum or an ideological orientation, um, which brings in questions around inequality, discrimination, even humiliation, um, both not just about people who access care, but even in the way in which our institutions are structured. More recently, I've been doing some work on um, health workers, hierarchy, gender, caste, and class intersections, and trying to really bring forth this this rather big problem we have on feminization of health work, uh, poor wages, insecure work conditions, and this kind of task shifting that's happening from the formal to a semi-formal, I would say, because whether you look at the ashas or any of these other programs, you're really moving. So the public sector itself has commercialized in a particular way, and I think work contracts are a very important way to see what happens to the question of social justice, and where is the voice to counter this, both in institutional settings as well as uh, in people who access care, who need care, etc.
Okay, thanks, Professor Baru. That historical lens provides a great deal of the landscape from which you are speaking. And when I listen to you, I hear that you have drawn your definition or your understanding of social justice over the time periods. But I do hear a lot of conversation around European values in structuring health science. I also hear a lot of how people are rebuilding nations. And I also hear a lot about focusing on poor and marginalized communities. And when I'm hearing those things, I'm wondering, you know, in Canada, in Canadian context, often we problematize those very sources. We problematize taking a European lens. We problematize looking at the poor and marginalized as poor and marginalized. We like to challenge those very structural inequities that are used in language to further marginalize people and create more power inequity. And I just wonder if you wanted to speak to that, because I feel like your next piece in what you shared in that first question really does start to bring about some of those pieces through the lens of class, caste, and gender that you had started speaking about. Do you have any thoughts on that?
Um, I've had very, very serious problems, especially in the last 30 years, where a lot of the health work has been metric oriented. So you have the inequality debate being focused on the poor. Uh, you know, um, eh, I mean, and India has had a history of looking at the poor, the large public programs, that anti-poverty, which is probably one of the largest next to Brazil. So you had the state intervening on the issue of reducing poverty, lifting people out of poverty, using rather innovative ways, not just looking at income poverty, but translating caloric values into, So, I mean, I'm not going to get into the details of that. But I think what really happened in the 80s and 90s was the liberal economics started looking at, or if you like, I always say they sort of targeted this the poor. So the relational issue got lost, and I think it's actually very self-defeating to just look at the poor, the marginalized, in ways in which either through the lens of income or through social identities, because when you do that, you kind of lose sight of the relational aspect, that okay, the what is happening to the rest of society, how are values and ideas changing, and how is it that what happens to the elite is very important. What happens to the upper middle class and their behavior matters a great deal, especially as we become more and more consumerist in the way in which our society is evolved, and that there is a social gradient which is not adequately acknowledged in the way in which this the project on marginalization plays itself out. So, I mean, I in a lot of the work I have done and also the classes I've taught, I've always said that while it's very, very important to capture the lives and lived experiences of those who are marginalized, but if you don't, it almost becomes like a laboratory study of, okay, those people out there, but there is this relational aspect of what do I think, what do I feel, how do I behave. Um, so it absolves the upper middle class and the elite, and I'd say sections of the middle class, uh, from even any forms of self reflection. So you either have this reaction of, okay, let's do something for them, but let's do it which is not as good as it would be for us. That kind of, it translates into that, or it spurns a great deal of disdain and hatred and anger against those who are marginalized. So I think that being one part of the piece, we forget that marginalized communities in a society which is, experience high economic growth are also becoming aspirational. And so it's not just the aspirational middle class. Of course, that is there, but there is also people from marginalized backgrounds who want a better life and who are investing, hoping that they get that better life. But all those, whether, I mean, I have had students who have, for example, looked at access to markets, um, uh, you know, from traditional occupations, from leather workers, etc. And there also, the caste angle and the especially the caste angle and the networks that they form. So it's not just an economic issue. I think the economic issue is sorted out by the now the present government just doing a whole lot of cash transfers, vouchers, targeted programs uh, as income, uh, benefits. But it is not challenging. In fact, what I find is there's a consolidation of both caste and class identities that can act as great barriers to any form of social mobility. So, what does it do to people from marginalized communities? I mean, I think it creates enormous levels of frustrations that we can't even imagine. Access to employment, access to opportunities. So, you're as good as a middle class person in terms of your educational qualifications, but you're constantly negotiating various forms of barriers as you negotiate the social and the cultural environments. And this is where I come back to my personal of how you unlearn that if you're in an environment where you are actually engaging with young people who come from those very diverse backgrounds, and you have a space where they can express what they feel. And I remember I had a PhD student um, who was from a Dalit community. He had lost his parents. They were both construction workers. He had gone through, government hostels, scholarships, and he came to JNU. He did his PhD. He was a first generation learner, had great difficulty, but he was very perseverant. And I still remember when he finished his thesis, my colleague and I, who were his supervisors, said, "Let's go out for lunch and celebrate." And when we went out for lunch, he said, "Ma'am, this is the first time I'm actually sitting with my professors." And then he said, "I really don't know how to read this. Uh, I find it very difficult um, because every step I had to learn to negotiate JNU. Because JNU suddenly said, this is a democratic space. And I didn't understand what this democratic space meant. Because wherever I have been, I've been told where I belong. And suddenly, when you say, let's sit and eat together, it's very overwhelming. And I think I understood. I unlearned many of my own assumptions that this institution, which stands for democratic values, I mean, it's just given, right? It's given because I'm able to negotiate it, but otherwise it's very difficult.
Right.
And I think the only time I understood that at a personal level was when I was in England for a year and I
Mm.
faced racism. I understood what overt racism was and what
Yeah.
covert racism was. And a lot of people who were friends who professed to be, very understanding, but I realized that understanding is one thing, but to live it is a very different thing. So that's where the positionality issue comes in. And I think till you experience some form of discrimination, you cannot really understand it.
Okay. So, Dr. Baru, I think you've answered some other questions as well. So I just want to clarify if we could put them there. So, question number two is, what, if any, are the social justice issues you have encountered in your area of expertise? And you had mentioned class, caste, and gender, the feminization of the healthcare work profession, and the commercialization of work contracts. And then also for uh, what are some social justice initiatives that are occurring in your discipline to help build awareness and or address social justice issues? Um, you started speaking to how in the past it was very metric oriented, and now we're developing a little bit more of a conscientious approach with social determinants of healthcare. Is that an accurate reflection of what you've said, or would you want to add something to question two and three?
I just want to say the metrics still dominate in
Okay.
policy making, but I do think that the fairly robust civil society movements across the world, which are not necessarily driven by one ideological perspective. I think the interesting thing about civil society movements, um, I would talk about progressive civil society movements because one of the things that happened during neoliberalism, I mean, the rise of neoliberalism, was the way in which international organizations reconfigured the civil society space. And I think that's a interesting piece of research that somebody should pick up because I think the funding priorities and a lot of funding that came in, whether it was through the World Bank much before the Bill and Melinda Gates came on the scene. And, they fundamentally transformed both global institutions, the national policies, but very importantly, they co opted civil society, they created civil society. And so those kinds of civil society organizations were very, very different from those who were, came out of either civil liberty kind of organizations, the left, and in the Indian case, the Gandhian socialists, uh, and just very liberal or people who had this conscience of social justice driven. So it's a very interesting space of the multiple ideological strands that came together. There were, of course, tensions, but there was this broad idea that inequality is not acceptable. That, and feminist movements in India played a very, very important role. I think, especially in health, where questions around not just women's access to care, but also questioning biomedicine, the use of technologies, the idea of controlling women's bodies, reproductive choices, etc., etc. And there were a number of initiatives from civil societies at the grassroots level that used women's health as an entry point for social justice. I'll talk about the Women's Development Program in Rajasthan, for example, and the famous Bamri case of rape against when she was campaigning very actively against child marriage. And how, so there here was the state-sponsored program, largely coming out of the work of civil society organizations, women's civil society activists, and translated into a state program. But you saw the limits to that when the backlash was on a woman who was working. And this has happened in many, many contexts in different parts of the country. So, to me, the progressive civil society movement played a very important role in contesting, in also providing alternatives through these various civil society organizations that tried to build grassroots work, that brought in the questions of social justice into their work and the limits of it. So, I mean, there was this, but those spaces have shrunk in the last, I'd say, 10 years, um, in the way in which the government has engaged and the way in which the funding landscape has changed. So it's a combination of the two. Then, of course, the alliances that were made with other people's health movements across the world. And of course, you have the global level as well today. So I think there has been that history also of building alliances um, across post colonial societies. So, whether it was Bangladesh and Zafrullah Chaudhry for a rational drug policy, or the influence of Sri Lanka's experiment with nationalizing their pharmaceutical industry. I'm talking about the 70s. So there has been this movement led largely by clinicians, interestingly, who were very, very active in this campaign, and they did influence even global organizations, UN organizations for alliances, including the earlier avatar of WHO, which of course has undergone many, many iterations and changes and pretty much been reduced to not really having any uh, influence in that sense. I mean, they have technical influence, but they like to believe that. But beyond that, they don't really have that normative mandate that was there in the 70s and up to the 80s. So, and there again is the story of commercialization of even these UN agencies and the way they got further and further compromised from their original mandates.
Okay, so just to recap, so it's interesting listening to you speak about these civil society movements and feminist movements and this alliance building in a time of economic growth and great change in the world. But at the same time, you've also, hinted at the fact that we are now in 2024 seeing a limited amount of grassroots initiatives. We are seeing that there is a lack of funding to support these type of grassroots movements. I would like to know if you could comment a little bit further on the role of grassroots organizations and their commitment to social justice, and is who do they cost to be in existence? Because the story that you gave about the Rajasthan-based movement, it's very clear that a female who was leading that grassroots initiative ended up having to, have her own dignity violated in the process. So I'm wondering how you understand grassroots organizations, if they are still champions of social justice or if they are harmful and creating a great deal of negative implications. What is your advice on grassroots organizations?
See, if we look at it today, the biggest grassroots network of organization is funded and supported by the RSS. People underestimate and they have done it over the years. They've built schools, especially schools. So you see and also they have grassroots presence. Now, we don't have a good documentation of who they are, what they are. But I think what is we need to understand when I say civil society spaces are shrinking is the spaces for progressive civil society grassroots initiatives. So, I mean, my direct experiences is being on uh, managing committees and boards of. Uh, I don't want to. I mean, you can edit this out, but this is something I want to just share. Uh, the FCRA regulations have made it very, very difficult to get this foreign contribution from uh, organizations abroad. And many of these were dependent on progressive funding agencies, say from Europe as well as the United States, for the kind of grassroots initiative. Because the Indian funding itself is very small, Indian philanthropy is not very imaginative, and Indian philanthropy itself is controlled by the government. So, I mean, controlled, I mean, not just in terms of who they fund, but even in terms of their own stances. They don't take very bold stances, right? Where there have been either missionaries or others who have done some. I mean, so when I say civil society, grassroots, I don't just mean those who are working in communities, uh, but I also mean institutions that have supported communities. So it could be a dispensary, it could be a hospital. And some of my own work shows that there has been a systematic closure of many mission hospitals, partly because their funding sources have dried up from the West, but very, very importantly, um, their commitment to social justice does not allow them to commercialize. And, I'm talking, and some have commercialized. There are many instances of missionary hospitals that run like corporate hospitals today. So they're not any different. But I'm talking about the smaller networks run by sisters, mostly women, uh, in very remote areas. And I have direct experience with the leprosy story because I work closely with the Leprosy Mission Trust. And what I find is that there's a certain fear if you're a minority institution, um, uh, because you're always under scrutiny and you feel that there's surveillance on you. This is true for a lot of progressive uh, grassroots organizations, and many of them have had to curb their role, change their role. Some of them have closed down, you know, because it's not just funding, it is also about, if you cannot do what you want to do in the name of social justice, if you don't contest local politics, uh, which are subversive to this whole project, who are creating hate and spreading violence, um, then what do? You either get out or you reinvent yourself, but you're always looking over your shoulder. So I think this is a fairly complex space, and a lot of this space now is being taken over by the RSS in many ways in which we haven't got adequate data. I remember there was one paper long back on how a lot of the funding from the West, you see, that is the other thing, the role of the NRIs in funding, in contributing, in donating. Some of this has been documented for the state of Gujarat many years ago. That it has really been under the radar, but it has been done very systematically. There is a plan, there is a strategy, there's a design. And I don't think many of us, and I say that many of us even took it very seriously. And I say that about JNU also. We just felt, oh, none of this is going to come back to us, till we were completely broken. And the way we were broken, and I mean, we're not the same JNU. We don't have those spaces which we had. So, I mean, I think it would be foolish to say they came and they conquered. They didn't. I think we were equally foolish not to anticipate. We maybe we lived in La La Land, uh, where we believed that these progressive values would always remain the way they were. No. And the way in which the middle class has completely bought into this ideology. So, whether you're looking, and the upper middle class, whether you're looking at the bureaucracy, the police, all the four arms of the state, media. So, you're perpetuating and supporting ideas that are actually very anti justice. And it's okay to do that, you know? Uh, and I think if we don't look at it in that interactive fashion, we will just be sitting here and saying, oh, the BJP or the RSS and their ideologies, you know? But it's much more than that, I think. Some of us didn't really engage with the world that was changing very rapidly in front of our eyes.
Okay, so in respect to the question number 3, you've spoken to in some ways to acknowledge some of the in some ways how grassroots organizations today are very vulnerable and susceptible to being misused and taken advantage of as a bottom line. And it seems as though that in your discipline, in order to help build awareness and or address these social justice issues, it's about having honest conversations about what is happening to the grassroots organizations. And it's interesting when you say that, when you're looking through an institutional lens and recognizing that your institution that stood for, public education and social justice was also and didn't see this rapid change of commercialization and privatization and economic and neoliberal ideology coming in with a sweeping force. And so I wonder if there is anything now that you are at that point of realization, and perhaps your colleagues are as well, is there anything that is being done to sort of address this new space that we find ourselves in, and the fact that we've problematized what grassroots organizations are now standing for?
I think the learning from JNU was uh, there was a lot of protest. I mean, it was a protest which was unimaginable against whatever was happening, say, 8 years ago. But there's something called fatigue that sets in. The fatigue came out of the fact that this was an unrelenting struggle. Um, and the way they managed it was they used punishment against teachers, they used punishment against students. There were arrests, but in the case of teachers, the punishment was you wouldn't get your pension, you would have a case against you. So once you had a case against you and you retired, you were struggling to get your pension, which meant you were in court battles. So just this, and you wouldn't believe the number of cases that have been filed against JNU, and JNU has spent so much money on their lawyers. So that itself, and I'm sure that's in the public domain. And so what we are really seeing is really the hard arm of the state. Uh, and I think, I mean, we theoretically spoke about fascist tendencies, etc., but I think we lived them. And so what happened really was a certain level of fatigue. But having said that, there's still teachers in JNU who continue to, uphold and keep contesting. But apart from JNU, there are other networks that have formed. Uh, there's a forum for freedom of academics, which is a broad forum of teachers from different universities in India who are talking about the kinds of issues that teachers are facing, etc., etc. Um, so, and then there are also alliances being kind of forged in the academic community with Canadian and American universities, especially with Indians in teaching positions there. Having said that, and I think another reflection I have, which I know is not very palatable, is that the broad social movements that one had in the 70s, 80s, even, um, backed by political parties, especially the Communist Party, all the various colors of the Communist Party, um, had a different flavor to them. The two things I want to say. Firstly, the lack of imagination on the part of the Communist Party, whether it came to questions of gender or caste, I think actually undermined this broad solidarity that could have been put in place. I know as a student in JNU that I was part of the SFI, which is the student wing of the Communist Party, and I was also very active with the feminist groups on campus. And I was clearly called one day and said, don't trust the feminists. It was a Women's Day program, and we wanted to do a week long of film festivals. And so, I mean, I said it's a great idea. We should do it. Then I was called by the SFI and president and said, "Don't do this because you can't trust the feminists." Of course, I went ahead to do what I want to do, but therefore I was always a suspect. Um, but having said that, you see, the feminists themselves had, especially the radical feminists, had their own differences with the Communist Party, because for the communists, the gender question would get resolved with a class question. But that wasn't the position that either the socialist feminists or the radical feminists really took. So what happened was there was a kind of a fragmentation of social movements. So you had within the feminists also there were differences. As later the question of caste came up, and the Dalits within the Communist Party, and I know women Dalits especially in Kerala also, or in Maharashtra for that matter, they became very creative in their endeavor in building uh, their movements, giving it an intellectual. It's not just grassroots, it's also about other institutions. And here I would specially mention the work of Sharmila Rege and others in Maharashtra, where they brought the intersectionality between gender and caste. And I used a lot of her material in my teaching um, for public health, where it wasn't just about problematizing this intersection between gender and caste, but it was also providing material to actually teach a classroom. How do you bring these ideas? You can talk about it theoretically. So there was a kind of a project to, uh, you know, bring out narratives, testimonials, translations, encouraging Dalit women to write about their lives, where they brought this intersection between class, caste, and gender. So she brings out this uh, book called Writing Caste, Writing Gender. Extremely powerful, extremely useful. And I was teaching doctors, so you can imagine if I started talking about theory of caste, class, and gender, I would completely lose them. But I use these narratives. And the latest experience is I teach a module on social and behavioral sciences for an ICMR institute. These are all mid level doctors working in primary health centers who come to do an MPH, which is a master's in public health. And over the last few years, I've been using Sharmila Rege's work to make them read a narrative, to engage with that narrative, and to bring, what they feel about it. I am shocked that it is a huge hit because it is a mixed class, but more importantly, the upper caste, mostly men, suddenly say, "Oh my God," you know, they actually engage with it emotionally, which is very interesting. So I think the strength of even the assertion of these feminist Dalit feminist kind of movements has been very powerful at an intellectual level. It has visibilized what it feels to be marginalized. And I think work of political scientists like Gopal Guru, etc., who brought in vocabulary for us of humiliation and not just marginalization, because I think it's a very insipid term because it doesn't quite capture what do these kinds of discriminations do to you at a human level. And I think reading Ambedkar, bringing Ambedkar back about what is a full human, I have excellent students who have worked with these concepts to look at embodiment. What does it do to your physical body? What does it do to your emotional body? What does it do to your spiritual body? So moving beyond just the physicality of it to what does it do to intergenerational transfer of pain and suffering? And how do you keep certain memories alive just so that you understand that this is exploitative, that it is not something that,
Mm.
it can be just sort of uh, washed away with a welfare program. It cannot, because these are very deep. And I think when the other very important thing that I think came up was the today, and I'm sure this is the case in the West, this very idea of feminism, of how the upper caste and upper class look at it, and how working classes look at it is very, very, again, a very fractured landscape. So you find young women these days talking about rights over their body. It's a very liberal feminist kind of a thing, but they have no engagement with what is happening to women from other castes and class. In fact, there is a lot of anger and disdain against them. So I think I'm bringing back this relational issue. We've lost relational relationality in the way we look at. So what if you are a third generation educated woman? Um, I mean, when I hear stories of young women and social media and their angst, their ideas of how to build relationships, what matters in a relationship, it really sets me thinking. There's certain things they never fought for. In fact, I speak to my friends who were with us. I mean, we were all together, and they said, even our daughters, they just they think it's their birthright. They haven't fought for a thing. We fought for them. We had to create spaces in our families. We were told we were not doing the right thing. We made choices that were against the grain, but now it is like, oh, me, myself. So this atomization of self, and and which is why I go back to why we need public universities and good public universities, because if you go to private universities in India today, and there are a whole lot of them, as you know, you could be in Yale, Harvard, I don't know, Simon Fraser, anywhere in the world. They're bubbles. They're these very smart kids who have had a lot of financial and other support. And teachers love to teach such people. But there's no real understanding and engagement. But having said that, there are also
Mhm.
wonderful kids from middle class families who have gone back to do very, very innovative things. I mean, I can't tell you what proportion there would be, but I'm not making it a hopeless case. There is a lot of questions around environment and climate change and things like that that has come into the debate of young people.
Oh. Okay, so I think that you've sort of spoke to some other things that you have seen in terms of to build awareness of how we go about understanding some of these social justice issues. And in contemporary times, you can see there's more an introspective instead of a collective sort of vision. And often, you know, I would even argue that the idea of community ethics or to do greater for everyone um, has become lost in this sort of self-centered view of not only in education but in society and what you called atomization of self. So I hear your frustration with that. I must say that unfortunately I have witnessed some of that myself. Anyhow, with those thoughts in mind, let's move to four. It's more personal. And again, please share what you wish and leave out what you don't. How do you respond to microaggressions or forms of discrimination, if any, that you have experienced?
Um, when I look back, I think, uh, and I always tell my students this, I think the family is a great space to look at microaggressions and the condonation of microaggressions, um, uh, where the so-called the issue of age and gender come together. Um, very clear, uh, you know, things that you should not do, and the boundaries you should not transgress, the questions that you should not ask, right? And for me, the personal is that I grew up in a joint family. Um, both my parents had to support a lot of people, so we lived in Delhi in a small space, and I think there were about 8 members um, living together. I'm talking about this as a child, and I saw microaggressions in my life. They're not micro aggressions of my grandmother really, really exploiting my mother, both emotionally and physically, um, where she was a high school teacher, but the way in which she had to give her the entire salary and had no control over her own salary. Uh, I was a witness to that. And later in life, I also contested this issue with my father, where I said, why didn't you stand up to your mother? Why did you allow this? Because he was an economist, he was an academic, and he clearly understood the problem intellectually. But when it actually came to drawing the boundaries, he didn't do it out of fear. Mm, and I think constantly we are negotiating, um, what do you call it? Some form of equilibrium. You don't want to upset the equilibrium because the loudest voice gets its way. And, uh, so I saw microaggressions play out in that fashion in my childhood. Um, I reacted to it. And I think the other thing that I really reacted to was the Brahminical orthodoxy of the family I grew up in. I saw, I mean, of course, one read a lot later on to understand what is Brahminical patriarchy and what is the space that uh, women get to for self-expression, um, and how caste gets played out in everyday life. So one saw all that, but also one contested all that as one grew up, and and I wouldn't say that it's just my exposure to being in the US that changed that for me, because we were actually surrounded by Indians who were very much, and if not even more, steeped in those very values that I had sort of grown up hating. Um, but I think it was largely the ethos of the 70s that helped us to question structural inequality. So whether it was the race movement or the feminist movement or the student movements and the anti-Vietnam kind of thing that influenced a lot of our questioning. But having said that, I mean, I think when I decided to get married, um, my husband and I decided we won't have a conventional uh, wedding. We went for a civil marriage, and that was a very hard decision, especially for his family, which was very, very orthodox in these ways. There's something about Indian families that when you look at middle and upper middle class families, they have the veneer of modernity, but you know what you see is not what you get. It's easier for me to deal with an overt Hindutva person uh, who has no pretensions of being that. But there are a lot of pretenses and masks as you go up the hierarchy. You hide your prejudices, you hide your biases in the name of modernity. But when it comes to, when I start teaching my course on caste, the first exercise I do with both doctors and social scientists is, so ask them, how does caste operate in your lives? Oh, no, ma'am, nothing urban. I start with the Times of India matrimonial pages. And I keep saying that it is the institution of marriage where caste is alive and being replicated. And it's not just caste, it's jati, subjati. So you can see how rigid it is as a system. So one endogamy, it becomes very important. But if you break those traditions of not performing the marriage according to Vedic ways, then it's a shame for the family that they couldn't control you, right? And I think I had a lot of difficulty as a woman to assert my space in a family which I married into, where um, the subtext was we are very educated. And this is the work of Uma Chakravarti, if you ever get to see her film she has made on her mother. And I think it had to do with Brahmin women who were so called very educated, who were well read, but they were never allowed to get out of their private spaces. It's the Brahminical patriarchy, the way it controls, and of course, it influences other castes as well. Um, I think coming to assert yourself to say that I want to work, I want to study, I want to be, was a lot of very difficult negotiations for me because my mother in law, who herself is an MA, has done her MA in those days, she's 97 now, would tell me that women in our family don't work. That was the first message I got. Then I turned around and I said, women in our family have always worked. My mother was a teacher, my bua was a teacher. I said, we've always worked. But it took a lot of energy on my part to stay on that course. And in fact, a couple of days ago, we were at a roundtable meeting on women economists. I'm not an economist, but it was very interesting to hear women who head institutions today talk about what they had to negotiate through the institution of marriage, children. And you're constantly, what should I say? You're creating space, closing space. And I fully understand when women just give up at some point. Um, there have been times when I've just said, maybe I should just not do this anymore. But now that I've retired, the best thing I've done for myself is to have stayed the course. But it is very, very hard. And I'm sure it's hard for you and Juliana as well. It's very, very hard. And when you talk about microaggression, a lot of microaggression in your workplace. Um, I keep telling people that the stakes in academia are very low compared to highly competitive spaces as you see them today, the financial sector or the corporate world, right? There, at least you acknowledge there are glass ceilings and this and that. But the microaggression of jealous male colleagues. So if you do well, you've done it because you've had some network to do it. If you get funding to go to a conference, why did she get it and why didn't I get it? And the microaggression is in the form of making you feel small, isolating you, um, talking down to your work, not acknowledging you, because there is some work which was done in JNU, which I think is very important in the education field, higher education, between managing our personal lives and our households and also being professional women. Where did we have spaces to network like the men did? The big boys managed it all. And they liked women who wouldn't rock the boat. So there were conversations with some of my women colleagues, and I remember telling them, you know what, you'll never become a rector in JNU because if you do, you would stand up. Men can smell women who are not vulnerable. or rather, other way around. They love vulnerability in women. Then they can manipulate it. But if you're your own person and you say, I'm not going to get pushed around by you, they won't touch you with a barge pole. Whether it is to become part of a team for a project, oh, I've had those experience even with the Lancet, so I know. Um, when I was invited to be a paper writer for the India series, um, all the stalwarts of public health, both globally and in India, are very excited to bring the India issue. They asked me to lead the paper on equity and um, kept telling me, oh, you have to change this a bit. Why don't you get a guy from Harvard who's very good? He'll help you recast your paper. I just said, I'm withdrawing this paper from the Lancet series. And I published in Economic and Political Weekly. And every one of them, including the women who were there on that group, came and said, you're being foolish. This is the Lancet. And you're just being very difficult. You have to learn to compromise. And I just said, I'm sorry, I can't do it. And I mean, if you know the world of public health, it had Srinath Reddy, it had Vikram Patel, it had the Niti Aayog CEO today, Vinod Paul. And but after that, let me tell you, I was persona non grata as far as these big boys were concerned. Didn't matter, but all I'm saying is that I have seen microaggressions and not so microaggressions. They can completely finish you off. You completely finish you off.
Yeah, and you had mentioned earlier in the interview something about microaggressions that were covert and overt in Paris, was it? In some part
Sorry.
of Europe that you had gone to, you had mentioned that, oh, England. England, you experienced overt and
Yeah.
covert racism. Can you just speak a
Oh,
little bit
yeah.
to that?
Yeah. This was in the late 80s when Salman Rushdie's book had come out, Satanic Verses, right? So I'm just giving the context when it was highly heightened. We were in Norwich and we were both students. And so we didn't have a car and we wouldn't even ride the bus so that we could save those £2. Um, and the overt racism was when they were actually, lager louds or non lager louds in cars screaming, go back, you black Pakis. And when we were walking, actually somebody coming and pushing you. Those are all very overt, a lot of abuse. So if you went to a pub and Norwich was more white than London, and they'd look at you like, oh my God, who has come into this space which is polluting us in a sense. So those were the overt, kind of both verbal and non-verbal. But the covert was, I would I always use this in my class, is when we went to the university canteen and the way you were served and the quantities you were served, especially if you had someone who was white behind you or before you. It took a lot of time before Sanjay and I actually started talking about it. And I said, do you find this? She doesn't even smile at us, but the next person, she's like all, hi, good morning, and do you want some more? I said, you can't put a finger on it because if you actually confront someone like that, they'll say you're imagining. So to me, this overt and covert played itself in many ways.
All right, so in the interest of time, I'm sorry we've taken so much of your time. We'll go to question 5. Where do you turn for inspiration and support when dealing with structural and policy inequities, if any, that you face in your field?
Um, I write. One, I write. See, I learned to be quite self sufficient. And I found writing as a very good medium to do that, put out ideas that may not have been accepted. But I think it's also important that I do have a network of colleagues, uh, intellectual uh, inspirations that keeps me going. Need not agree with them on everything, but There is, luckily, in India still that group. And I think my students have been a great source of inspiration and strength. Um, uh, just the fact that you grew with them as they grappled with new ideas and made me read things that I would have never read. Um, and also that I still keep in touch with them. I mean, they've all gone away, but they keep coming back and saying, "Ma'am, can you read something I've written?" And can we and co-authoring with students. I mean, who are no on principle. I did not co-author with students while they were still students, but a lot of them who have finished their PhDs now and are writing and want me to co-author, they become the first author and I become the second author. And so there is a lot of camaraderie in that. With colleagues, it's been a little less. Um, but I think the students have been a great source of ways of keeping certain ideas alive and exploring new ideas.
Okay, and so great. That's wonderful to hear the connection with students. Um, so the last question we have for you today, Dr. Baru, is what are some possibilities or recommendations that you have to help promote social justice education in your discipline?
Like I said earlier, one of the things I have, because we were a very small department, so I think my engagement with, whenever there's an invitation to engage with curriculum design, and for example, the All India Institute of Medical Sciences was starting a school of public health. So different, and then this ICMR Institute where I've given my time for the last 6 years, which is I call it an exercise in transplantation of ideas of social medicine into what is a very boring technical MPH program, bringing together a network of teachers from different institutions, but who have primarily trained from JNU, not just my generation, the next. And I've brought together former PhD students who are working now, but whose work I think is very important. So they come to teach in that program. So over years, I've kind of layered it. If you like, it's a succession plan. But it's not about me, it is about really keeping an idea alive because JNU and the department has changed considerably. Um, but how do I keep the repository of materials, of curriculum, of pedagogy? So it's very important for me because it is an ICMR, which is an Indian Council of Medical Research, which is an important government body. And this institution comes under it, which is the National Institute of Epidemiology. So this is not a private institution. So having said that, this these have been experiences of, if you like, translation, transplantation of ideas of social justice to come to speak. Interestingly, the private university scene has invited me for a couple of lectures, the Jindal University School of Public Health and Human Development, where I've had opportunities to sort of speak on this theme of why social justice is so important for public health. Um, and it's not just technical learning, which is important also. So, how do you mix and match the two? And how do you discern what is good technical learning and which will speak to social justice? So, I think these, and of course, being engaged with organizations in the civil society space, I'm very actively involved with an organization called Can Support, which works with cancer patients from largely vulnerable sections, both children and adults. And they do a lot of home based care, which is very difficult to do. Hospital based is very different. So I think I've chosen organizations where for them social justice is important and it matches my interest. And I'm able to sort of bring something that is useful for them or supports what they do.
Okay, so Professor Baru, only one tiny follow-up question. It sounds like you have a wonderful way of keeping the momentum going for social justice. But as you had mentioned early on in our interview here on the podcast, commercialization and neoliberalism has swept through. And now you are mentioning conversations in private universities that you have been invited to. It makes me wonder if you could share your thoughts on if you've ever felt like people have used your intellectual property and your intentionality to do the good work in social justice in a way that can be commodified or used as a check mark in what they need to complete. So, in light of neoliberalism and privatization and their impacts on private universities or in these grassroots initiatives, how do you know that you're not falling prey to those very same issues?
It's a very good question, but let me tell you, people don't touch me very much because they know my position on commercialization. You see, you have a group of scholars in India today who say commercialization. The problem, even with the Lancet paper, was I had formulated and conceptualized how commercialization is a driver of inequity. They didn't like that. You can talk about commercialization as a process, how we have to accommodate to commercialization, how best can we build partnerships with the commercial sector. That is the space which is very nebulous, right? So people will own you, people will use you, but let me tell you, people run away from a lot of the work I do. And the only reason Jindal invited me was this person, and they have a human development component. They're not like the Public Health Foundation of India doesn't engage with me. They'll find my positioning very, very problematic um, for their, because they get funds from everywhere and anywhere. They source commercial funding, and my kind of portfolio wouldn't work with them. And even the civil society organizations I work with, when I see their funding and I find that the funding is coming from sources where I don't agree with the ideology, I always say, listen, you find someone else in my place, but I'm not going to be part. I'm not saying I'm being purist, but I know that people also read my work and they know that this is not the language that funders want to hear.
Okay.
Let's stay away. Let's push back, including the People's Health Movement. I mean, I have differences with them as well.
Okay.
Um, yeah, I think some of them are soft on commercialization.
Okay. And do you think that the strength of your responses, which you spoke about earlier, a lot of people are, don't want to go into deeper questions of caste and
Yeah.
privilege because of fear. And you even mentioned your own, the story in your own personal life where your father was thinking about equilibrium. Do you find yourself ever hesitating because of the principle of equilibrium or the backlash of negative implications given the stances that you take? Or do you find that given who you are and where you are now, it doesn't matter?
It actually doesn't matter. And I think we've seen quite a bit of backlash from our own families where we are seen as rather odd and different. And, it's very interesting. I keep telling my students this. When you do something that is not within the accepted grain, you become the symbol of what others in your family should not do. And that has happened to me repeatedly. Don't do what she did. It's a mixed bag, right? So at one level there is this great admiration, but then there is this so it's not a real relationship. So I've got used to that. So I just say that it's okay. I want to live the rest of my life on my terms, but that doesn't mean I go around being abrasive with people or hurting people, because I love people, and I see them all in shades of gray, so it's okay. But there's certain situations which I will not compromise on. I'm very clear on that.
Okay, thank you so very much for all your insights and your wisdom and the narratives and the examples and the richness that you have shared throughout this podcast with us and all of our listeners. We really appreciate it. I'm sure you have inspired many people, including myself, tonight. Thank you very much for your time.
Thank you. It was a pleasure meeting you, and I hope we can keep in touch.